That's what's been fun for you. You finished your first 2 years of medical school, which was bookwork
constantly,
day in, day out. Lots of lectures every single day.
Mm-hmm.
And what was really fun during your experience, it was during COVID. And so your whole first year wasn't even in class either, right?
Yeah, that was a whole pain in itself. But it was interesting.
Yeah.
How so?
Well, because there was no actual interaction. So they actually had to like redo our whole schedule. So they front loaded the entire like course load of like just pure learning. So like, we do labs and stuff as well in med school, but they had to push all those later because you couldn't go in person. So it was just straight, all just didactics, all just like your biology, biochem, genetics, all that. So like everything on a medical level, which some of it was more extreme than what I've learned in undergrad and some was less. So it was kind of nice, that little balance. So some I had to study a little bit more for. But yeah, so it was just a heavy course load of work. Well, most of it they spread out over the 2 years in learning, but then we just had it all straight up right at the beginning.
My goodness.
So it was good and bad. I was feeling pretty much like my full years of undergrad again in one semester. And then the second semester we got back into labs, and that was a little bit more fun, actually. A little bit more hands-on with stuff.
Definitely.
I've heard you talk about labs before. What exactly do you do, or like what are labs?
So the main labs, we had those 2 years. So I'm actually at a DO school. It's a little bit different than MD. So big part of it is called osteopathic manipulation. So it's kind of a little bit what chiropractors do. Actually, the chiropractors are a break off of the DOs when they're first starting. So they learned a lot what we did, and they kind of copied it and made their own. So a good portion of it, I think we have 300 credit hours worth of OPP. So that's where we go learn how to do those things, muscle manipulation, cracking backs, all that fun stuff. So it's good. So we actually get hands-on, which is more than a lot of the MDs. They don't really touch patients as much. So DOs are better. They can touch and they can feel like, okay, I feel like your tissue is a little bit different here. Like it's like feeling like on the abdomen or the back, like, okay, that kind of means there's something else going on there. And you can kind of use that as a diagnostic tool. Wow. So that's a lot more fun. So we're much more hands-on in that sense. And then the other labs, of course, are learning like diagnosis things like how to use a stethoscope, how do you look in an ear, things like that. So things that doctors should know how to do. So you get a balance of that.
And so now you've transitioned into year 3 of medical school, which is rotations.
Yeah.
So now you're actually in the hospital working with patients, working with doctors. What's that experience been like?
So that's been a blast. I was kind of worried at first because like it's like you're in the real world now. Like you're actually on this spotlight. Like you're constantly having to like work and do all these things. But it's been a blast. I've worked with some really good doctors. And mine's actually a little different than a lot of other rotations where I'm one-on-one with a doc. Lots of them, like there's maybe like 3 students and they're working with the resident. And so that's usually the rotations. So the fact that I'm there one-on-one, they send me in a room, I get to go see a patient, get a history, do a physical on them. And I try and figure out what's going on with them first. And then I go back and report to the doc like, hey, I saw this. They have these symptoms. So I think they might have this. Maybe we can do this as a treatment. And then they go in and confirm. And so they say, oh yeah, no, Dr. Larkin was good at this. Or soon Dr. Larkin, he was on the right track. He was going this. And it's like, we'll do these steps next after that. So it's been a lot of fun doing those just kind of more hands-on. You get to go visit and talk with people. It's not just looking at a screen all day reading books. So nothing beats being in the real world, being with the person one-on-one.
Yeah.
So when you do rotations, are you there for like a whole day, or like is that like essentially like a job that like you go in as like a doctor?
Yeah, so you do month-long rotations. Gotcha. So and they do a bunch of different specialties. So like my first one, which was kind of lame, was a virtual ped. So I was at home, so I don't really count that as the first rotation. But the second one was surgery. So I was in for the whole month. We go in and I work with a surgeon. So we go see patients all day, and then in the mornings, usually in the hospitals, we go and have our couple surgeries that we had in the morning, which I actually got to go scrub in. I got to help hold retractors. I helped throw a stitch a couple times. Wow. So you got to be hands-on with them right there with it. So
you were doing a lot of pacemakers.
Yeah, mainly he was a thoracic cardiovascular surgeon, so he did a lot of just like that. So he used to do like the whole heart transplants and everything, but right now he's mainly just doing pacemakers and a lot of wound care. So if they come in like with a huge like bed sore, especially all the COVID, people laying on ventilators for months, they get huge bed sores on their backs. And so he would have to come debride the wound, which means like take out all the rotten flesh and like put grafts in and restitch it back together. And then most of those you can't close. So you have to put like a wound vac on it and just let it close over months by itself. And so it was a lot. So we did a lot. So a lot of the stuff that was in the outside in the clinic was taking care of those patients. So you stitch them up in the hospital, then you got to take care of them afterwards.
Gotcha.
So that was my first rotation for that. So that was a fun experience. Very high intensity right from the get-go. Working with a surgeon. Surgeons are not always known for being their bedside manner, so it was a little bit harsh at times, but he was great. He was a really good doctor, taught me a lot. I was able to learn a lot. So it was fun. It was a good experience. Definitely one of the hardest months of my life, but it was a good experience.
Oh my goodness.
I was just going to say, what's been your favorite rotation so far?
So I actually want to go into family med. So I just finished my 2 family med rotations, and that was a blast. That was like funnest, where I could actually just go sit and just chat with the patient. I mean, the doctor's really good. They're like, take your time, go have fun with them. If you take long, I'll just go see the next patient. So I could just sit and talk with them, really start thinking things through, learn how to ask correct questions, and dive down those paths. Because that's all experience. Medicine is a practice. You're practicing going down the differential pathways and thinking, oh, they said this, so maybe it might be this thing. Leading down those. So it's fun just experiencing that firsthand doing it. So family med really enjoyed. Actually really enjoyed rheumatology as well, which isn't a normal first year rotation, but somehow I ended up in there.
This might be a stupid question. What is that?
So rheumatology is a lot of things like rheumatoid arthritis, psoriasis, kind of those autoimmune type diseases. So a lot of people don't like it because it's monotonous, but I was micro and I did immunology in my undergrad. And so like all that stuff just clicked with me. It was fun figuring out the mechanisms, like why deep down is your autoimmune system not working, or your immune system's not working correctly. They have these autoimmune diseases. So I really enjoyed that, thinking it through and just putting all the puzzle pieces together. So those 2 have been really fun so far.
What I find interesting is both in rheumatology and then in the family med, it's very similar to what we do in the Dan Purser MD clinic.
A lot.
And so I think was it a good experience for you to just get some hands-on experience before you come and actually work in
definitely. And it's good to see how the mainstream is doing it and saying, okay, so there's so many times I'm sitting in a room where I'm thinking like, oh, I have this product. I know that will help them so much, especially like pain patients, even a lot of the autoimmune, like knowing like glutathione could just help with all these things, the SOD. But I can't say anything. It's not my place as a student to tell the doctor, okay, you need to be trying this with your patients, because it's not appropriate at all. So there's so many times where our guys just dying, especially in rheumatology, where like, because it is so autoimmune and all of our products help with the immune system immensely. I was just like, I just want to try this. I just want to see this, if this will help with them. But I said to hold my tongue and just like, wait, okay, now when I get in my practice and I see these things, I know what I'm going to be doing. So I can really see if I can help these patients, because so many are just suffering, especially rheumatoid. All of them are in so much pain, and just knowing like we have the CRMX that can just help with the pain. Like, I was dying every single day trying, like, God, I can help you. Let me help you, please. But I can't.
I know you were telling me a story one time, or just telling me about one of the doctors, I think, in rheumatology that had been using CRMX for his own hand problems.
Oh, it was the family med doc.
Oh, it was family
med. He had really bad back issues. And so like I gave it to him one day. He's like, oh, yeah, I'll give this out. Because he's trying a bunch of like Voltaren gel. He was a big proponent. And it works, but you have to apply it for a couple of days before you start getting an effect. And he would tell every single one of his patients that too. And he used it himself. I mean, tried. He's like, oh, yeah, this is good. This is like, it's actually helping. And he's like, oh, the lidocaine in it, that's great. I'm like, oh, it's not just the lidocaine that's helping with that. But yeah, there's more things in it.
No, it's been fun hearing your stories from rotations.
Yeah.
I was going to mention too, in case people didn't know, me and Jared are brothers.
Yes.
Actually.
If you can't tell.
And so we're actually the stepsons of Dan Purser MD. And so we've been around the medical field for a long time. And Dan says all the time that Jared is the only one that followed his advice and went to medical school.
Just listen to him, did what he said. Gave good advice. I'm here now, 3rd year in, just still going strong.
I'm not gonna lie, when I first met you two, I thought you guys are twins. Like the whole time, like when Brad's like, oh, like Jackson and Jared. And I was like, oh, like J and J, like they gotta be twins. Like they look so much alike. I didn't know, because I knew you guys were similar in age and you look the same age. And I'm like, I think they're twins. Like I'm not gonna say anything. And I think when I got back from my mission, I realized like they're not twins. Like they're just brothers.
Yep. I wish I was as tall as Jackson. I just got unlucky.
But going into a little bit with that, what made you go into to become a doctor? What drove that?
So it's been a lot watching Dan over the years, because when I was younger, he was doing a lot more pituitary research, and I found that all very fascinating. So I was actually thinking for a long time I wanted to go into pediatric endocrinology, because there's so many kids that just suffered. And the sad thing is with pediatrics, especially with those specialists, when they turn 18, they just let them loose. They don't really tell them like, oh, go see this endocrinologist to continue care. And so I wanted to do that, but be the bridge and gap and help them so they continue lifelong care. It's morphed over time. Our practice has changed. Dan's practice has changed. And I can definitely still do a lot of that without going fully into endocrinology. But just seeing people suffering and just seeing the things that we've been able to do with our practice of helping people change their lives, get back to normalcy, it's always been a big driver of what I wanted to go into medicine, to be able to be a part of those journeys with those people, to help people get back on that pathway to health. Because it's so hard to watch people suffer and struggle. So that's been one of my biggest reasons of why. Just ever since I was a teenager, just like I want to be a part of that. I want to be able to help people to feel good.
I feel like being a doctor is gotta be like one of the most challenging jobs or professions to ever go into, because you always have to be thinking about others. I think that is just so incredible, especially how you're saying like you, from a young age, you wanted to go into that. For the longest, I just want to make the most money as I could. I wasn't thinking about helping other people, but I think that is so incredible that you, at a young age, you're like, I want to go help people. I want to make sure that they can feel their best, because I know they can feel their best. That's amazing.
No, it's been really nice having that goal from a young age, because I've so many of my even classmates, they wandered for years. I have one guy, he was a PA for years before, now he's in his 40s going through med school. But just by having that goal and working towards it. So like that was always the focus. So it was never a question of where I wanted to go. And so because of that, things just lined up to just work greatly to my favor, which I'm really grateful for, being able to do where I'm at right now. Yeah.
That's what's so fun, just because we've been part of the family business for a long time, half of our lives essentially, and that's what was fun for me over like the last 10 years working with Dan one-on-one. I didn't work so much in the medical practice. I helped with reception and learned how to do phlebotomy and other things. But I studied some science and other things in school and just worked hands-on with Dan and our other partners for a decade. On our product development side and our business side. And it was so fun because Dan always said, oh, this is Jackson. He'd introduce me to whoever we're talking to. This is Jackson. He's going to be running everything one day. He'll be running our companies. And I never really understood what that meant. But like you, I always had that same goal as like, we have things that can actually help people and really change people's lives. And so for me, that was always my driving factor, is just I want to be able to help as many people as we can.
Oh, yeah.
And as I've really buckled down in taking our own products and our own services seriously, I've learned finally to deal with my own fibromyalgia and take under control the problems I have with MTHFR. And once I started really doing it for myself, my life completely changed. And now here I am at the point where Dan has put me in charge of running the companies. and we're making it.
Yeah, we're doing it. It's a journey, but we're doing it.
But that's what's so fun is as we continue to build into the next generations of just what Dan has built and what our mom, Denise Purser, the two of them, they started the clinic together almost 20 years ago. And it was just the two of them for the first few years.
Yeah,
as like you mentioned, Dan was studying everything he could about pituitary, really to first be able to save his own life after his horrific car accident and having gone through. He was in a coma for a little while. Everything he had to rebuild himself.
Oh yeah.
And so in that process of trying to understand how to even save his own life, he was then able to open up the pathways to help thousands and thousands of people. And now he's educated people all over the world, which is so fun. And so now, I mean, the goal is one day for you to be able to step into the practice and fill some shoes.
It's big shoes to fill.
But that's all still in the works. And Dan isn't going anywhere. He loves working with his patients every day.
Oh, yeah.
So one of the cool things I was going to mention is the couple other family members that we have interworking within our businesses as well. Our sister Bailey, who's a nurse, who's always talking about probably going to nurse practitioner school as well.
I'm pushing her. I want her to work with me.
Yeah. And then her husband, who is a master paramedic and a firefighter. Both of them love being part of what we're doing as well. And so what we're building together with them as well to offer more nutrition and other fitness sides of our services is really fun. I think there's a lot of really cool things that are going to be coming about in 2023.
Yeah, no, that's something that makes me so excited. Like I'm sitting there during rotation, like I just want to get back. I want to be working. I want to do all these things because I know we're doing so much more. And that's the thing with so much medicine, everyone gets stuck in their trenches. They're just seeing their same patients every day. And they try and they do it. Doctors, they do a great job, but they don't have the time to do the research like we do because they're so heavy patient load. And what they have to do, they're seeing the patients and they have their job to do, and they do a great job at it. But there is so much more that we can do. So I'm glad our business has the opportunity to grow, to not just be focused in one thing. Like I said, we're endocrinology research at 10 years ago, but now we're so much more. And we still incorporate all that, and we can build and grow and do all those things. So that's why I love what we do, because it never stays the same. Every year is different because we find something, there's these new technologies, and we're trying to stay on that cutting edge. Because if not, you just fall in the wayside and you just get stuck. So I get so excited thinking about, what's this going to be like in 3-4 years, and I'm finally back and I can be working. It's going to be a different business, which that's great. Yeah. I'm just hoping I can jump right in and keep growing and help it go.
Yeah. definitely. Innovation is always at the core of what we do.
Oh, yeah.
That's what I've loved working with Dan and our other partner, Steve, and some of our other people, is that we are constantly researching. There's always something new. People are discovering something new. And that's what we're really fun. What we get to do on our side is we are beginning our own research as well, handling our antioxidants and pursuing those mechanisms.
Completely.
Which is really fun. And we've got a lot of work ahead of us with that as well. But that's what's so fun. We really have things that can change the world for people. One of the things I wanted to bring up, as we've talked about, like family medicine and just and endocrinology, a lot of what the practice has shifted to is looking at genetics, really a root cause issue of a lot of symptoms that people deal with, and then the vitamin deficiencies that can and are most likely caused by these genetics.
Yeah.
And so that's what we look at is the intracellular vitamin deficiencies, the vitamins and minerals, amino acids, and antioxidants, what you are low in inside of your cells.
Yeah.
And that's what makes us different. That's really what has completely changed the math for most people.
Oh, completely.
Because every doctor will run a blood serum test and look at all your vitamins and your hormones, everything there. And that is a great snapshot. It tells so much information. But then you take it one step further and look inside of the cells and see what you're really deficient in. And then why are you deficient in those?
Yeah.
Is it trauma caused by genetic issues? Do you have genetic issues caused by trauma? Is it just nutritional deficiencies? It's so much fun. Take a look at that. Treat those root causes and then let the person get better.
Yeah.
It's amazing. And we do that time and time and time again.
No, it's so exciting. And that's the thing, like medicine is slowly catching up with that. Like all the new PCR testing, especially for like bacterial infections, is getting more mainstream because it's expensive technology. You have to buy the equipment to do it. And so the more and more hospitals are getting it in their spots and they're using it more. But it's been fun that we've been doing that for almost half a decade already. Yeah. And they're just barely catching up with all those things. And the intracellular testing, like no one is doing that. Most people don't even know what that really even is. Most doctors don't. So they've been told like, okay, get your CBC, get your CMPs, run these different blood tests, and it's good enough. Yeah, like you said, it's a good snapshot. And for just basic health concerns, it catches the big things. But now let's figure out, why are you fatigued all the time? Why are you in pain? Because most of the time, they'll just ship you off to pain management, which is sad, but that's all they can do because they don't have the tools and resources that we have to actually figure out why are you having these symptoms. Yeah. It's really sad. So a lot of the time when I hear them going to pain management, oh, I wish we could do more. But at the same time, it's just all that they can do.
That's what the one topic of fibromyalgia is. One I deal with it, and so it's one I find very interesting, and I'd love to try to understand everything that we've come to understand about it. Because we have a couple products that are designed to specifically treat one of the root causes that we've seen, which is copper toxicity caused by dysfunctional metallothioneins. And Dan has talked about that for years, and most people have absolutely no idea what that means.
I don't really fully understand what it means. I get the gist of it, but I'm still learning.
I've read into it and studied it many times, and I still don't fully understand. But the main idea is that the proteins that move copper and zinc and other heavy metals around in your body are dysfunctional.
Yeah.
And it's a genetic error, or several different genetic errors that cause these proteins to not function well. And so what Dan and our partner Steve had discovered, with the help of some naturopaths and other people had researched this for a long time, is that there's several amino acids and a couple of vitamin Bs, I think, that if you supplement with the correct versions of these, they go and they help support the metallothioneins to function correctly. And so that's where our Copper Balance product came from, in conjunction with our glutathione. And as we've talked about many times too, one of the main parts of glutathione is N-acetylcysteine. And so the metallothioneins actually use N-acetylcysteine and glutathione molecules those are the mechanisms that go and connect to and catch onto copper and other metals in our body. And so when we deal with fibromyalgia patients, what we've seen is that they have buildups from either years or even decades of copper around their body, causing pain points.
Yeah.
The pain points that everyone with fibro gets diagnosed with. It's just built up all over.
Spots, yeah.
Yeah. For me, it was all over my back. I had back pain forever. And so one of the first steps that we do with these patients is we put them on a low copper diet. Which is super fun. I mean, it's not fun because you have to cut out all the foods.
All the good stuff. Got rid of that avocado, which is the best.
Definitely. But that's what's so interesting is everyone eats these superfoods because they are excellent. They are packed full of nutrients.
Everything you need in there, but yeah.
But then the problem that they have is that it's packed full of copper as well. And so for these patients that are unable to process copper, it becomes toxic to them, and it really hurts them. And so even just that, you start with a low copper diet, And we have our patients do it even for like 4 to 6 weeks and just see how do you feel. And their pain dramatically decreases just by avoiding foods high in copper and trying to cut copper out of the supplements that you're taking already. At that point, then we help them start on our products where we can fully do a detox and then allow your body to start processing copper normally. And so for me, that was exactly my story. For years and years, I just was in pain and I could not get over it. With the pain comes anxiety, comes depression, comes fatigue, comes gut issues, all of it. It just hand in hand. Those are the symptoms we see with everyone. So getting to the root of that with fibro, and then also looking at all the other vitamin deficiencies. I'm just one simple case study of that. It works. Exactly. It's really something cool. And now I can't eat avocados. Now I eat all kinds of foods. Yes, yeah.
You have to get it in balance and keep doing it. And that's the thing is you have to continue all those things. And that's the thing, they like bypass a lot of the mental things. So that's the really cool thing, especially like with our MTFR support, stuff like that, is you're bypassing the pathways that are dysfunctional. Because that's the thing, they're broken. They're not going to work again. Yeah. Nothing we can do about that. But we can bypass and give you the correct things later in the pathway, which is a really cool thing. We have the technology to do that now, that we can see, okay, you have these pathways broken here, skip here, and that way you continue on the work function normally at that point.
Exactly.
So it's amazing that we have these products that can do that and just bypass the whole problem completely is what's really happening.
Wow, that was really cool.
Yeah. Getting down to the heavy science stuff for a second.
No, I'm just like trying to digest that. I'm like, man, how you guys can remember those names so well. I'm like, wow, that's impressive, and how to pronounce it correctly too.
But nothing's ever correct in medicine. You just make it up and go with it.
Yeah. If you say it with confidence,
exactly. Yeah. People get it. As long as you're in the ballpark, that's all that matters.
Yeah. Oh man, that's crazy. That's so cool though. I think it's because I think especially with the shift in the world right now, I think there's so many people that are trying to find a better solution. At least for myself, it's just a lot of times it's just you put a Band-Aid on, you hope for the best, you hope, hey, hopefully by next year you'll get better, or hopefully this is just a phase in your body that you're not feeling too good, your back hurts a lot, X, Y, and Z. But I think finding the actual causes to things rather than just taking a prescription, rather than just suffering through everything, there has to be a solution to everything. Yeah. And there has to be a natural solution, because especially with Dr. Purser, how he spends so much time just trying to find a natural way to solve your body issues can make a world of a difference.
Yeah, because that's the thing. It's really sad because the medication, Western medicine, is great. They do a lot of things. I was hearing really interesting guys saying we can keep you alive nowadays. It doesn't matter you have diabetes, have high blood pressure. No one dies from those things really as much more. It's getting rare. It's more rare. It's still a lot of people die from, but it's getting better. But the thing is, keeping them alive, their quality of life is going down. So people that used to die from these things, now they're living an extra 20 years, but they're suffering and they're in pain. So that's the amazing. So those drugs, they work and they do good things, but a lot of them have all these horrible side effects. So that's why it's amazing we can treat and manage these things with natural options. Your body is already using it. Your body knows how to function and do these things with it. So then all those side effects disappear. You don't have to worry about those anymore because your body is doing it the way it's supposed to and knows how to do it. So as we continue to find these more ways to treat these things naturally, it's going to be amazing. So that we can keep them as if they have the high blood pressure for 20 years, but now we can treat the blood pressure and keep them alive without all the side effects. Hopefully we can get to that point over the next few years.
Yeah, increasing quality of life.
Exactly.
Yep. That's always one of the main goals of everything that we do. Even talking to Bailey, as she's worked in the hospital over the last year as well, she's worked in the ICU, specifically on the COVID floors a lot. Yeah. And that's one thing I like talking to her about, is how resilient the human body is, and that how much it actually can go through and still be alive. But that's not our goal. Is not to just let you be alive.
Exactly. We want to thrive.
Yes. And that's what we really do have many options for.
Yeah.
And just like John said, the Band-Aid solutions. Not to bring up fibromyalgia again, but I've been researching a lot into it lately, and just the if you Google just what are the top treatments for fibromyalgia, or how do you treat fibromyalgia, what it says right on there is antidepressants and pain meds. And for me, that's so incredibly sad, because it's just that we're just going to try to cover it and just try to live life.
Yeah.
And of course, that person is just going to continue to suffer.
And I've seen some of those patients, especially in the rheumatology, because fibro is covered by rheumatologists. So we had a lot of those patients. That was when I was really holding my tongue the most. I was like, I know these fibro patients. I've seen this a million times in our own practice. And I want to tell them, point them towards us. But again, I can't do that as a student. Can't jump practices like that because it's wrong. But just seeing them suffer. Just like I did see it all the time. They were on those SSRIs. They were on pregabalin and gabapentin a lot of time, which those ones aren't as harsh, but they can be pretty harsh as well. But they get minimal relief. Like this, they're still suffering every day. They can't sleep. They can't eat. Yeah. They just suffer. And they're just barely hanging on to life. Yeah. And so it's tragic to see that, but just seeing that we can manage it and that we can give them a quality of life again. It's amazing to see that we can do that.
I like Googled like how many people suffer from fibro every year, or just in the United States. It says 4 million people.
Yeah. Probably that's
honestly did not realize like it's that high. Like
and
I was
underdiagnosed.
Yeah. And I saw like one of the frequently asked questions is why do physicians not believe in fibromyalgia? It's because they said because they don't have the adequate knowledge or like resources and research into it, how to treat it. And I think that's where Dr. Purser, that is so crazy. Like when you read about that, it's like, wow, they say that they don't even know how to solve it, but Dr. Purser, he's done the research and he's spent the time, he's put his efforts into it to actually figure it out. Like maybe not treat it 100%, like because you say it never go away, but you can make it a lot better.
Yeah, you can live normal life.
Exactly.
Manage the symptoms and have good quality of life.
Yeah, that's the whole goal. Yeah, because like this thing I've seen that every practice I've been in, there's always fibro patients, and every single one of them, the doctors dread it when the fibro patients come in because because they're suffering, they're in pain, and so they're usually not always the most happy. A lot of them are, but a lot of them they're just struggling, and they've been to so many different doctors, like getting to the rheumatologist after being through a family med practice, and then probably a couple other specialists before they even got the diagnosis of fibromyalgia. And there's no cure for it. There's no treatment, especially in just normal medicine, and so like. They know they're going to come in. It's the same story every single time, so the doctors dread it because they know they can't do anything to help them. And then all they're going to tell them is like, continue on what you're doing, and we can take you to pain management to help try and manage symptoms. And even then, it's not even close to enough. So it's really sad. So a lot of the time when they would see that and they're dreading, I'm like, oh, can I just bring them to Utah? Can I just get them a plane ticket to come over, come see them, point them in the right direction to get the help they need? But yeah, so it was really interesting to see that, and I'll probably keep seeing over the next couple of years because every doctor knows it. It's become so prevalent nowadays that fibro is a thing. So it is getting better diagnosed. So that's good. So the awareness of it and the recognition of it being a real thing is becoming more mainstream. Now what you do about that is the hard question. How do you manage these patients now?
Yeah. No, and that's one of our goals is we want to expand and try to help as many people as we can. Yeah. And hopefully expand our clinic and expand our own education resources so other doctors can easily follow along. Yeah. And truly help people.
Yeah, no, because some of them have lost so much hope. I think that's part of why the doctors struggle with them too. Because if patients lost hope, how can you help them? Yeah. So the fact that we can do that, give them life again, it's a big deal. Definitely, it's not easy to pass up.
One thing I want to touch on real quick, and I don't know, maybe this is maybe too controversial to talk about, is even just physician burnout, especially post-COVID years.
That's huge.
I know because Dan talked about it all the time, and he talked to a lot of his different physician friends and just was able to observe a lot. And he has interesting opinions on a lot of the actions that doctors took during COVID. Yeah. Many were very scared, as most people were.
Oh, to me, that should be like the doctor's heyday. Like, hey, we've got a pandemic. Let's get this done. This will be the best days of our lives. Yeah. Who can say they worked during a pandemic? But a lot of doctors, they didn't feel that way. Physician burnout is a little different than the COVID situation as well, because that's just been a thing that's been going on for decades, of especially dealing with insurance, patient load, the requirements of doctors without sufficient pay, which is, no one likes talking about money, but doctors, they get paid well, but the amount of work that goes into it, it's hard on them. Yeah. So especially with the new insurance policies and everything, it's just become so much harder. But with COVID, a lot of these patients, like so many doctors stepped away and left the practice because a lot of them were specialists. It's like, oh, I don't need to deal with this. I love Dan's mantra at the beginning of the pandemic was like, we're all family medicine now. Everyone needs to take care of it. Just take care of the people. Like, why did you become a doctor? And that's the thing. A lot of people become the doctor for the prestige. They're not coming for the right reasons. And so you probably saw a lot of those doctors, the ones who were in it to help people and those that were just doing it for the prestige of it all. So it's a very telling thing. You should probably pay attention to that with your doctors and see what side they're on for that. Doesn't mean they're bad doctors, but think of who you want to be taking care of you. And so during COVID, during that time, since so many of them were so overworked, especially the nurses and the doctors, everyone all together, they just got all burned out during that time. So I think the COVID burnout is different from just normal physician burnout. And they're still struggling to catch up now. They're still trying to figure out this new COVID world, which is sad. Medicine's still not normal. It will never go back to normal at this point. This is the new normal, I guess.
What do you mean by it hasn't gone back to normal?
Well, just so many doctors are still scared to even touch a patient. I think it's getting better, but there's a hesitancy now that wasn't there before, which is kind of sad because doctor is a hands-on business. You need to go, you need to touch a patient, you need to look at them, you need to listen to them. There's so many times I've even seen patients myself where like, oh, I haven't had a doctor listen to my heart in years. Like, that's just my standard thing. I did get a history. I'm going to listen to your heart and lungs. Doesn't matter what you're in for. I'm going to listen to it because that's what you need to do. You need to catch those things that are just can be easily caught at those times. And of course, they have other things you go a little bit deeper in their physical as well. But some doctors just don't even want to do that anymore. It's sad.
And so, I don't know during your rotations if you did like telehealth or like if you did over like Zoom or anything.
It's becoming a bigger thing. Yeah. And I think telehealth has a very good place in medicine for little things, quick checkups and things like that. I think is a great thing. But if someone is sick, you still need to put your hands on the patient, especially if they have like strep throat, ear infection. You need to look at it because it could be other things as well. So telehealth is a great resource and a great tool, and we've used it in our practices. Every practice I've worked in so far has used it. Some doctors like it better than others. But it is a great tool and a great asset, and used appropriately works really well.
Yeah, I think when I got sick at the beginning of the pandemic, it turned out I was taking a probiotic that was not reacting well in my stomach. But I had a meeting with like a doctor like over Zoom. That was like the first time I ever had it, and I was like, "This is like so cool," because I'm like, that was like one thing I dreaded going to like, the doctor's office was because I saw sick patients, and that sounds really bad. I know how that sounds, but I see sick people around me. I'm like, I don't want to get sick. And as well, like, if I'm sick, if it's contagious, I'm like, I don't want people to be getting sick because of me.
That's fair.
And so I was like, man, this is so cool. And I didn't have to like dress up. I didn't have to get out of the house. I just was in my PJs. I called the doctor, and I'm like, that was it. That was so cool. And actually, it turned out to be actually a really good experience. But I'm like, man, I'm like, if they changed it all to this, like, and unless if it's like what you said, like strep throat or like actual sickness, I'm like, I'm not mad about that. That's pretty cool.
Yeah, no, it definitely has its place. It's a good resource, and a lot of the doctors, the ones that use a lot, they love it because it's a lot easier. It is easier, I'll say it, but yeah. Well, there's even whole new hospitals they're building that are pure telemedicine hospitals. Wow. So it's really interesting to see. So like literally just have a building with a bunch of just, I don't know if they even have individual rooms. It's almost like call centers. And they just have the doctors just go work at the call center and they just get the calls all day. So they just, all day long, all they're doing is just seeing patients telemed. So it's becoming a new thing. So like, it definitely has its place, but there are rules and regulations with it right now. So definitely I think strep throat, either they have to come in or there's like little things you can buy that you can like take pictures in the ears and like send it to the doctor or look in the throat. So there are like regulations. So they have that, then they don't even have to come to the doctor's office. So definitely for your young family, little kids getting sick all the time, they're like $100, invest in those things, and then you never have to go see the doctor again. But yeah, so it's going that way. It's looking more and more. Telemedicine's gonna be a bigger part from now on.
My parents will love that when we were growing up.
Yeah.
Oh my goodness.
So yeah, it's interesting because we've had a couple of telemedicine courses I've had in med school. They're always interesting to learn and see what the new rules are with it all.
Not to only make it about our products, but my question for you is, what is your favorite product that we have?
Oh gosh, my favorite one right now is brain support.
Oh yeah,
definitely. I would not be doing med school without it. I was just taking 2 a day forever, and I was doing good. But even in the clinics recently, like I go and see a patient, get a full history, walk out the door, and I immediately forget everything I just talked about. I was like, wow. I'm like holding the paper. I'm like, okay, I'm glad I at least took notes. I can go and piece together what I just heard. And I upped it to 3 a day, and that problem went away. Because my brain fog, I didn't even realize I was having brain fog and energy before that, low energy. And so 3 a day just changed the whole game for me. I was able to go and see patients. I felt my whole attitude changed with them. I was able to go and just give a full history directly without looking at my notes anymore to the doctor and remember it all. So it's been a game changer. So brain support definitely is my favorite right now.
And do you know the mechanisms, how brain support works at all?
there's a bunch of all the good stuff, CoQ10, PKU, and all that stuff in it. So I don't know exactly what the mechanism is.
Yeah.
I didn't do my own research, but I just know it works. It works great.
It's what we hear time and time again from people, either customers or even our like manufacturers that actually manufacture the product for us. They tell us it just works.
Yeah.
I can't tell you what it is exactly, but it just works.
Yeah.
One of the cool things you said exactly the two ingredients that are in it is just PKQ and CoQ10. They're two antioxidants, very important in the energy pathways and very important in CoQ10, especially in so many pathways throughout the body. They are used molecularly everywhere.
Oh, every single cell uses it. It's the end of the energy transport chain.
Exactly.
So,
and so for whatever reason, even just supplementing with those versions. And the cool thing with the versions that we use is they actually have sustained release.
oh, okay, that's even better.
And that's why even taking 3 a day works.
Yeah.
For a long time, just because I do an intermittent fast every morning, I was taking all my vitamins right at noon. And so I wasn't taking my brain support until noon.
yeah, your whole
into
day's
halfway
off.
through the day. Yeah, my whole morning I'm just like, okay. The PKQ specifically has a 12-hour release. CoQ10 has 24-hour, which is interesting. And so that's what I switched to as well. I started taking 3 capsules of brain support every day. So I actually take 2 like first thing in the morning, and then I take the 3rd at lunch. And I don't know if that's the best way to do it or not. But
I just take 3 in the morning. It's been working for me. But
yeah. But it's so fun. You and Bailey, and I know I've heard from a couple other students, specifically in the medical field, they just say this works.
it's a game changer. It really is for me. Yeah, no, my whole rotations changed once I started doing that. I felt more confident walking in, talking to the doctor, just having just that extra memory knowledge changed everything.
Yeah. It's almost like that movie Limitless.
Oh yeah, a little bit. I wish it was just random knowledge coming to me. But
Yeah.
one day we'll get there.
Yeah, definitely.
I wanted to get into real quick before we got into like the practice and all that with your med school. Could you just walk us through like a normal day? Because I've always wondered what like a med school student's day is like.
So like in the first years or the third, 4th year?
All of it. Like just, we can take some time. I just want to hear like your whole.
So the
whole
first
day.
2 years is just pretty normal school. This was like being in college again. So usually we had classes starting at 8 a.m. till noon. They are like back to back packed. So sometimes we'd even go to 4 p.m. So we'd have class from 8 a.m. to 4 p.m. So those were really long days of just lecture after lecture after lecture. So that was more like my first semester. So that was when I was pure just virtual, watching it all on Zoom. Then the later next 2 years, we had the lab. So usually be lectures in the morning, lab in the afternoon, and you do that 2 to 3 times a week. So just pretty much normal, straightforward school is what it really was like. But 3rd year is a lot more fun. It's a little bit more flexible depending on where you're working at, where your rotation site is. So I'm working mainly outpatient clinics, which is nice because usually it's like 8 to 5 most days. So it's just like working a normal job in that way. So you work, you see patients in the mornings, see them in the afternoons again as well. So you just work a normal day, seeing a patient load. And it varies depending on the practice, how many they see in the day. If they do procedures, some do like knee injections and things like that, or I work with a neurologist for a month as well. And so like in the afternoons, a couple times a week, we do like EEG. So like looking for seizure activity. A lot of them too, like looking for carpal tunnel. So we'll do like, I'm blanking on the term, but it's like the needle conduction studies. So they literally stick a needle in you and shock you to see if like your nerves react or not, or other ones they'll shock you and see if like you'll clench or not. So it's just looking at your nerve health. So like carpal tunnel or neuropathy, things like that, you can determine, see if is it the actual cause, like is it a nerve cause or is there something else going on, or like which part of the nerve is broken a lot of the time. So it's fun. So each practice is a little bit unique. It's a little bit different. Every day is different, really. You work 8 to 5, but you never know what's going to happen in those hours. There's an patient work. Sometimes you have one come in, the patient will take up 2 hours of your time, just because things happen. So it's been fascinating. I really have loved the 3rd year more than the first 2. Because first 2 it's just college again, just with a little bit more intensity. It's like 30 credit hours a semester versus normal 12. So it's a lot of work, constant. Wow. Yeah, there's a lot that goes on in those 2 years. So it's been nice to have. You'd still take tests 3rd, 4th year. So in every rotation, you'll take a test based on everything that you learned.
But you don't have like coursework.
No, there's no more coursework. So a lot of the doctors I actually enjoy, they'll give you a little reading assignments at night, like, hey, study up on hyponatremia tonight and tell me what it's like tomorrow. And so you get a little bit of homework to do in the evenings on top of your normal studying as well. Because you're still studying the whole time too. Because we have board exams, everything. It's a never-ending cycle. Can't wait for the day I don't need board tests anymore, but that will never happen. But yeah, so day in life, it's just, just work.
Off the top of your head, what's been one of just like the coolest principles or the coolest just medical phenomena or anything that you have learned about?
Oh gosh, The coolest.
Just what's been the most fascinating?
That's
to
a
you?
good question. I like that one.
The actual diagnosis and getting to things is usually more simple than what most people make it out to be. And I remember in my undergrad years, I had one professor who said like, the easiest answer is never the correct answer. And I just disagreed with that so much. Because I had another professor, I TA'd under him. He's like, good research at the end of it will make it go, well, duh. Yeah, of course that's what it is. That is what a good research is. Like they take the problem and they can explain it so eloquently. You're like, oh, of course that makes sense. And I feel like that applies a lot to medicine. When you get to the correct diagnosis and you put everything together, you should be like, oh yeah, of course that's what this person has. That's what it is. So when you're getting to that point in medicine, you're able to diagnose, you're able to put things together, look at the lab values, look at the person, especially mainly you look at the person, take their history. It just all kind of falls into place. And I'm still learning that. I have a long ways to go till I can get to that point. But I love that. It's been, especially the neurologist I worked with, he's been 20 plus years. And his whole thing is like, I can walk in the room, see the patient, and pretty much have an idea what they have, just from his years of experience. And just looking at patient basic history before he even sees them, maybe he has a lot of value, you can see and put it together. So I'm looking forward to the day when I can be able to do that, walk in a room, like, oh, okay, yeah, no, this person has Parkinson's disease. Like, I have no idea how you can do that, but one day, hopefully I can get to that point.
You see the patterns.
Exactly. Yeah. And so, yeah, we get to the point like, well, duh, of course that's what it is.
That's really cool. That's excellent advice.
Yeah.
One just little comment. I know Dan has talked about that always as well. As he's gone around the world and met thousands of people, he always likes shaking their hands, especially with women. And he quickly can see if they have very cold hands or not.
Oh, yeah.
And just that is such a quick diagnosis real quick for a couple of different things it could be. But just that, you look for those patterns.
Yeah, you can start a differential immediately. You might need a little test to back it up and confirm, but yeah, you can usually get it right off the bat.
Yeah.
Yeah.
Wow.
So,
That's cool.
Yeah.
That's all my questions. Thank you, Jared.
Yeah, no problem. That was a lot of fun.
Appreciate you coming in.
Yeah, it's been fun. We'll get you back here too.
Of course,
one of the next times you're back in town, but hopefully we start making more content with you as well.
Yeah.
Yeah. It's been fun watching you go through med school and preparing a new way.
Yeah. Trying to apply everything I learned. It's been fun merging everything of all the normal mainstream with all the extra stuff you can do on the sides.
Yeah.
Because there's a place for both in all of it.
Oh, yeah.
It's just picking, okay, what's the best? What's the best for my patients is what it really comes down to. And so I'm looking forward to being able to apply that one day.
Yeah. Fantastic. Well, thank you.
Yep, no problem.